So welcome everyone. Welcome to today's EPI-WIN webinar. Thank you for joining. Today our webinar is on Universal Health and Preparedness Review, UHPR, from national to global preparedness, solidarity for a safer world. It's great to have you with us. For those who are new to EPI-WIN, this stands for the WHO Information Network for Epidemics from the Science and Knowledge Translation team in health emergencies. With these webinars and associated slide sets, our goal is to translate evidence and science in an accessible, understandable, and relevant ways for evidence-informed actions and decisions in public health emergency preparedness and response. We have a great panel today before us to discuss UHPR. As you know, UHPR has reached a significant juncture in its journey and completed the first ever global peer review in February 2024. And you will actually hear from the countries themselves about their experiences. So far, 10 member states representing 5 WHO regions have completed this pilot project, and it's enabled intergovernmental dialogue, peer-to-peer learning for health emergency preparedness, involving the highest level of leadership in member states. To start this webinar off, we are very privileged to have Dr. Samira Asma. She's a well-known figure in the public health sphere. She's Assistant Director General for Data Analytics and Delivery for Impact Division, and she will provide the opening remarks. She ensures, in fact, that health data is reliable and accessible and used to improve health outcomes worldwide. So welcome, Dr. Samira. Following her, we have Dr. Stella Chungong, who will give an overview of UHPR. She's the Director for Health Security and Preparedness, another well-known figure. Then we have distinguished colleagues from our countries. We have Dr. Paula Vasconcelos, who's the Coordination Officer for Public Health Emergencies Operations Center in Portugal. We have Professor Marcel Mebeko Simaleko. I hope I pronounced that correctly. He's a technical advisor in the Ministry of Health and Population in the Central African Republic. He's had several years of experience in public health at the national level and international level. He has expertise in the area of university teaching, health policy, and strategic health planning. And he's played an important role in the National Secretariat for the conduct of UHPR in collaboration with WHO. And finally, but not least, we have another distinguished panelist here, Dr. Chawetson Namwat, who's the co-director of the Department of Disease Control in the Ministry of Health. He's currently the country focal point for UHPR in Thailand, but he was also the spokesperson for the ministry and managed the DDC Emergency Operations Center during the pandemic. And he's got over 25 years of experience at Thailand's Ministry of Public Health. So it will be great to hear from them. And without further ado, I will hand over to Dr. Samira Asma. But just a quick housekeeping announcement. We are recording this webinar, so you will have access to it even later. We will also request you to please introduce yourself in the chat and where you come from, but keep your questions to the Q&A box. Please don't put your questions in chat because it can get lost. We would like to be able to answer your questions, so please put it in the Q&A box. Over to you, Dr. Samira.
is a ray of hope and a really bright North Star. The reason I say that is it involves not only ministries of health, it involves the heads of state and heads of government and multi-sectors, governments and non-government, civil society, and many other partners alike. So huge developments. So let me just walk you through the history and memory lane, how this all began. It was when Dr. Tedros was approached by two ambassadors, one from Central African Republic, the late ambassador, and the ambassador of Benin, coming to Dr. Tedros and said that why shouldn't we have a mechanism where member states to member states have a conversation on a platform of mutual trust and solidarity, finding solutions to keep the world safe and drawing from each other's experiences. And this was just around the pandemic. And Dr. Tedros took this idea, and today we have come far along, and it wouldn't be possible from the team you see in the room, led by, as I say, a force of nature that is Stella Shungyong, my friend and colleague who's leading this effort. Our role is just to support that this really matures and fulfills its full potential. So UHPR, colleagues, is a member state-driven initiative. And as I mentioned, it requires all of government. It also requires all of WHO to succeed. So this is, through this webinar, an invitation to you to join this very exciting opportunity. I just had a chance to be at the UHPR review in two countries, Portugal and Thailand. I missed the other countries, but there is unique stories and lessons that we are learning. So one little example, analogy I would like to mention that coins UHPR is what I mentioned at the inaugural UHPR session in Thailand. What I said is that UHPR is like a glass box where everyone can see, so it is visible, it is transparent, it has got a side that is promotes accountability and efficiency. So underpinning this is an accountability framework where every country will make progress. It's not only a review, it is about truly improving our pandemic preparedness and response on the foundations of universal health coverage and better health policy environments, without which preparedness would just become, again, a fleeting dream. And we don't want that. And all the lessons that we have learned and learn every day through the pandemic, outbreaks, and emergencies that you on the front lines are dealing with. So please take a good listen to the progress and the possibilities that we have ahead of us. It is quite an ambitious undertaking and also very exciting. So with that, I think Stella will walk us through all the steps, and then we will also hear from our country colleagues who have really done this process and believe in this process, that it can truly become universal. So over to you. Thank you very much.
Thank you so much. I believe Supriya is moderating this. Supriya, could I go on?
Yes, thank you very much, Dr. Sorry, slight tech issue there, but thank you very much. And now, just before we request you to give the overview, Dr. Stella, a quick question to our audience. We just want to know how much they know about UHPR. So colleagues out there, all participants, if you could just scan this Slido and answer this question. Those who are regular will know this very well. Do you want to show the response? So it looks like by a slight majority, many of you are not very aware of UHPR. We have another question, maybe for those who said yes, you can answer. How many countries have initiated UHPR process for health emergency preparedness? I'm glad you were listening and paying attention. Indeed. So you were right. The answer is 10. And for those of you who are not aware of UHPR, here's Dr. Stella to let you know what it's all about. Over to you, Dr. Stella.
Thank you so much for that. And I was actually quite pleased to see the number of people who know about it. So we hope that at the end of this webinar, all of you will be able to go out and talk about the UHPR and be very knowledgeable about it. But in case you still want to get more information, the team is there, the site is there. Please feel free to reach out and we'll be quite happy to give you more information. So next slide, please. We saw during the COVID-19 pandemic and other health emergencies that no country was well prepared for an emergency of the scale and severity and scope of the COVID-19 pandemic. Throughout the process, we saw that there were fragmentation in the response, that there were different strategies that were applied by different countries. But most of all, we saw that there was insufficient cooperation between countries and notably a lack of solidarity between many member states. One of the key lessons that we learned from this was that the world needs a platform for sharing of experiences, a peer-to-peer mechanism to review and learn from each other in order to jointly strengthen countries' defense and get better prepared for the next pandemic. Next slide, please. In this context, the Universal Health and Preparedness Review was announced by the Director General of WHO, and you heard the history, how this came about, with the AU and 2 ambassadors, the African Union, and 2 ambassadors pushing this process, and all member states are aligning around this process. So as you heard before, it is a member state-led review mechanism, and it is around strengthening health emergency preparedness, but bringing into account and taking into account all the underpinnings in a country that would strengthen this, whether it's through data, as was mentioned, through universal health coverage, through health promotion. All of these come together to build what we call today the Universal Health and Preparedness Review. It is innovative in the sense that it is engaging the national leadership at the highest levels based on information that is available within the country. It is innovative in the sense that it facilitates an interactive dialogue between member states on their capacities, on their gaps, on their best practices, but also on how to mobilize resources, be it technical, financial, or other resources. Most importantly, it serves as a platform for building mutual trust, accountability, and solidarity within, but also between countries. Next slide, please. So, what is this process? It is composed of 4 phases, And whilst we will focus on the national phase and the global phase, there is a concept note that is available that outlines the details of what should be considered as we move forward with this. So there's a preparatory phase, the national phase, the global peer review phase, but also the national follow-up phase, which is based on what comes out of the peer review and various recommendations. In the national phase, based on existing evaluations, and here, many of you have heard about the IHR, the International Health Regulations, monitoring and evaluation framework that consists of various evaluation methods and tools, including the joint external evaluation, the states parties annual reports, but also functional tools such as the simulation exercises and after action reviews and intra-action reviews, as well as the national bridging between the animal and human health interface. All of these form the basis on which the UHPR builds in the country. And it then identifies the priorities that are related to three major areas: those of governance, those of agile systems, and those of the financing, and this through a whole of societal and whole of government approach. The outcomes of the national dialogue are reflected in the national report, which is validated at the highest levels of the country. The peer review phase provides the unique opportunity for interactive dialogue between member states. This is where member states identify areas for future collaboration and coordination of their actions for improvement in terms of national health, security, and health emergency management. This global phase enables the mutual learning and sharing of best practices, potential solutions, innovation, as well as the opportunities for bilateral collaboration and support. Next slide, please. So this has been an exciting 3 years journey from when the DG announced the UHPR. As you can see and was mentioned before, in the World Health Assembly of 2022, a concept note that lay out the key principles of the UHPR was noted by the Assembly, which is the governing bodies of the WHO. Between December 2020 and May 2023, the UHPR national process was piloted in 5 countries, notably Central African Republic, Iraq, Portugal, Sierra Leone, and Thailand. And you'll be hearing more about their experiences later on in this webinar. The experiences learned from these pilots have helped us to further refine the methodology and process. An additional 5 countries are currently engaged in the UHPR process, and these include Cameroon, the Republic of Congo, the Dominican Republic, Luxembourg, and Tanzania. In January 2024, during our executive board, which is another governing body process of the WHO, a decision was adopted by the board mandating WHO to continue with the voluntary pilots and provide another report on the UHPR to the World Health Assembly in 2025. And in February of 2024, earlier this year, to complete the full UHPR cycle, there was a global peer review process, which you will listen to through a video shortly. In terms of the next steps, next slide, please. We will continue to consult with our member states on further developing the UHPR process and bringing on board new memberships. By engaging in collaborative discussions and soliciting feedback from all stakeholders, we will ensure that the UHPR evolves in line with our member states' wishes and their feedback and the lessons learned from the pilots. And in accordance with the decision that I mentioned before, we will compile a detailed report on the lessons learned, the implications, the benefits, the challenges, and options for the next steps of the UHPR. This report will be presented next year at next year's assembly. as a secretariat, we remain committed to continuing the consultation with you, our member states, with our key partners, with all the relevant stakeholders to further develop the UHPR. I will invite you to visit our website and feel free to write to us if you would wish to know more about the UHPR and how your country can be part of this novel process to ensure health security preparedness. I thank you.
Thank you very much, Dr. Stella. Well, thank you for that excellent, brief, but succinct and to the point presentation. We now have a little more to share with you on UHPR. As Dr. Stella mentioned, a video that explained it. We'd like to share this video with you.
There is no global preparedness without national capacity.
Today, we celebrate the visionary leadership and proactive engagement of the countries that have stepped forward to pilot the Universal Health and Preparedness Review. Today's gathering underscores our shared commitment to enhancing global cooperation, fostering transparency, and upholding solidarity.
I thank the representatives of the Central African Republic, of Portugal, Thailand, as well as Cameroon, Luxembourg, and Sierra Leone, who have accepted to join WHO on this journey.
If someone thinks the pandemic is a once-a-century crisis, but it is also a once-a-century opportunity to voice out how the collaboration in different sectors had been done.
Most important for us is that we understand what has happened, what are our weaknesses that we have to rectify.
Este mecanismo tem como chave envolver toda a sociedade e aproximar as preocupações técnicas com as preocupações políticas. Por fim, o UHPR pode ser visto como uma forma de empoderar o Ministério da Saúde ao convidar os diversos atores nacionais e a sociedade civil a contribuírem para a identificação das prioridades em saúde e apoiarem a sua implementação.
Les leçons apprises, d'abord la centralité de l'engagement politique. L'exercice de l'UHPR pour nous n'était pas l'exercice du ministère de la Santé. C'est l'exercice du président de la République.
L'exercice, c'est vraiment le véhicule politique qui est important parce qu'il s'agit de changer la façon de concevoir la santé au niveau politique, au niveau administratif ou au niveau communautaire.
Thank you in the name of my country and congratulate you for having conducted such comprehensive and impressive review. You're a true pioneer.
Nous pensons que ça fait vraiment du bien pour le Cameroun d'être là et de tirer vraiment profit, non seulement des rapports que nous avons eu à analyser, à examiner, que ce soit celui de la Thaïlande ou alors celui de la RCA, mais également de nouer ensemble des plateformes de coopération qui nous permettront de pouvoir atteindre les objectifs chacun dans ses priorités pour le bien de nos populations.
What we can clearly see is the leadership of member states moving forward. Having this mechanism is also engaging the other member states by having that dialogue, encouraging each other to continue and to strengthen their relationship to be better prepared for the next crisis that the world can face.
We congratulate Thailand for the successful piloting of the UHPR process. As a fellow CRO and ASEAN member, Indonesia gains from a strengthened fellow regional member.
I look forward to outcomes that help us to collectively strengthen national, regional, and global health security through a UHPR process that adds value without undue burden and duplication of efforts at country level.
It is very clear moving forward that this is very different from the shaming and naming that some other processes might have resulted in. And it has been around building solidarity, around moving forward, around taking the member states' priorities seriously and seeing as a collective global community how we will address these priorities.
Thank you very much for listening to that. And thank you to the UHPR team. You can see them all in our headquarters meeting room there with Dr. Samira and Dr. Stella. Now we go on. You've heard about UHPR. Let's hear it from the countries that have actually done it. What have they learned? So I'd like to start by welcoming all three panelists. And my first question is to Dr. Paula Vasconcelos. Dr. Paula, UHPR is a voluntary member state-led process. This is also seen as a paradigm shift in how we review country capacities for health security and preparedness. From your experience, what are the benefits of joining the UHPR process? What added value would a country, a member state expect from the process? Over to you, Dr. Paula.
Thank you very much. Good afternoon to everybody, or good morning. This is a large audience. We have more than 300 people online. So Portugal was part of UHPR since the very beginning because we engaged on the process. So the first thing in a way, it was a concrete visibility of our national engagement on international processes. COVID-19 was a good memento to understand that the demand to respond requires the same responsibility for preparedness and response in a national, subnational way to contribute to international goals. So we also believe that the fact that is a voluntary assessment process, it allowed to balance between the mandatory assessment tools and the voluntary process, meaning that you do not keep on only technical, you provide a kind of high level commitment within this voluntary kind of, we consider it the review that better maps the national capacities and capabilities, and also maps our partners. Being the UHPR was a way that we could understand better who were our stakeholders in the national level as well at the international level. It was the first time we had a direct dialogue between the country's authorities, the country's technical entities, the regional office and the headquarters. And it was a momentum that also people want to see how they contribute somehow to COVID, but now understand it better, the preparedness process. This mapping of the capacities and capabilities of the country was also very clear with the UHPR. What were the quantitative process that is common to other tools, but plus the qualitative process. How easy was to engage the different partners, because sometimes in this kind of assessments or reviews, how to make sure everybody feels that they are integrated within the process of this kind of contributions. And also within those methodologies, how not to lose the track with existing documents, repositories, documentations that the country usually do not have just like that, but are forced to bring up and to revise them in the umbrella of preparedness and response. It was also very clear for us that the process to bring universal coverage, so the health system, the healthcare delivery perspective within the public health setting, plus the civil society, plus the other sectors, allowed us to identify the lessons learned from COVID in this case, because it was really the momentum, inside and outside the health sector, and identified common challenges in regards to tools, information systems, management, that could be also important, how to move better to better preparedness. It was also the recognition how the health sector must lead when there is major problems affecting humans' lives. So in overall, I would summarize that the UHPR was an opportunity to systematic reconcile existing assessment tools, quantitative tools, with a more qualitative approach, where the technical and the government alignment is more clear, where the multi-sectoral collaboration combines the priorities for national preparedness and response strategies, how that can be better integrated under procedures, strategies, technical, but also governmental and political decision. And I would summarize that as one of so far process that aligns the political plus the technical plus the social society plus the other sectors, recognizing the health sector leadership when it comes to any risk, alert, threats to human lives. Thank you.
Thank you very much, Dr. Paula. That's a nice summary. You know, it's one process that aligns the technical, the political, the social, and getting together the leadership for the pandemic. Before we go to the next question, I'd like to invite the other two panelists also, if they would like to say a few words on this question.
Yes, Dr. Supriya, I'm Shreyasan from Thailand. May I have a brief
yes,
adding
please,
some point?
Please
yeah.
Go ahead.
The UHPR allow us, our country, to select a specific topic to go to deep diving in details. So it means it's like a paintings. In each country may found the different details. What is their strengths? What are the room of improvement? So that is from these details, other country can look in different countries and learn how to modify to their country. Thank you.
Thank you very much. So it's you know, looking deeply to look at your strengths and weaknesses, and then other countries can learn too. That's the strength, that the peer learning across countries. Professor Mbeko, would you like to add? You don't have to, in case you wish to. Any observation? No, you're fine. Thank you. Then, in fact, in that case, Professor Mbeko, my next question is to you. UHPR has three main areas under consideration: governance, systems, and financing. Having experienced a global pandemic, we now know how important these aspects are in emergency health preparedness. What support does UHPR provide to member states in improving these three key areas? And especially for member states that are challenged, you know, by situations like the humanitarian crisis or ongoing outbreak, as you've seen in the Central African Republic?
Merci beaucoup. Bonjour à toutes et à tous. Je voudrais, avant de répondre à votre question, rappeler quand même que le processus de
before answering your question, to remind that the UHPR process happened in Central Africa right after the COVID-19 pandemic. And the review enabled us to review the way in which the fight against COVID-19 was conducted, while laying the foundations for coordinated and effective effective response in the event of a new pandemic. The UHPR provides then an essential framework to help member states, such as the Central African Republic, a country with limited resources, to improve their capacity to respond to health emergencies. This review, which was organized around a number of high-intensity activities, required the involvement, on the one hand, and above all, of senior political authority, but on the other hand, of national and international experts. Let's come back to your question. The UHPR has supported the Central African Republic in three key areas, in particular governance, systems, and financing. In the area of governance, the UHPR was an opportunity to strengthen governance structures by evaluating and improving health security policies and regulatory framework. It is in this context that the Central African Republic has identified the gaps in current policies and proposed recommendations to strengthen legislation and public health policies. The UHPR has also facilitated the promotion of intersectoral coordination by identifying the levers for collaboration between different ministries and international partners for a coherent and integrated response to health emergencies. Finally, the review provided support for leadership capacity. We have helped to build the capacity of public health leaders and officials to manage crisis effectively, with an emphasis on transparency and evidence-based decision-making in line with the needs of the affected community. The second area of UHPR, as you said, is related to systems. These include the assessment of the state of infrastructure and measures for targeted investment to improve health facilities, laboratory capacities, and supply chains for medicines and other health products. In the area of human resources development, the UHPR has helped to identify key needs in terms of training and healthcare personnel, and has proposed programs to increase the number and skills of healthcare workers. Again, as part of the surveillance and early warning systems, the UHPR has helped to set up and strengthen epidemiological surveillance systems and early warning mechanisms to detect and respond rapidly to epidemics by integrating community networks. Financing is the third area of support targeted by the UHPR. The review assessed the financial needs to strengthen healthcare systems and proposed sustainable financing plans. The UHPR has also helped the country to identify and mobilize funds from donors, financial institutions, and development partners. The third aspect of financing concerns the efficient management of resources. Faced with a problem associated with aid effectiveness, the UHPR has proposed strategies to the Central African Republic to improve financial management and the efficiency of health spending, ensuring that resources are used optimally to strengthen all the pillars of the system, including emergency preparedness and response. Some specific aspects of UHPR contribution to countries in crisis are worth highlighting. These include, among others, strengthening community resilience by involving local communities in the planning and implementation of responses to emergencies, and by building local capacity to manage crisis. The support can also include technical assistance with
pour faire
immediate
face aux
operational support
épidémies
to deal
et
with
autres situations
epidemics and
d'urgence,
other
y
emergency
compris l'envoi
situations,
d'experts et de
including
fournitures médicales.
the dispatch of experts and
L'UHPR
medical
a
supplies.
été enfin une opportunité
Finally,
pour renforcer le
the
partenariat
UHPR
et
was an
la
opportunity to
coordination
strengthen
internationale.
international
Le processus
partnerships
de
and
l'UHPR
coordination.
facilite
The
la
UHPR
coordination
process
avec
facilitates
les agences des
coordination
Nations
with the
Unies, les
United Nations
organisations non
agencies,
gouvernementales. Aussi, la
non-governmental
revue par les
organizations.
pairs
And
permet de
also,
bénéficier
the
des
peer
expériences des
review
pays pour la
provides an opportunity
consolidation
to
des
learn
stratégies
from
de
the
réponse aux
experiences of other
problèmes qui
countries
limitent
in
les
order
capacités des
to
pays
consolidate
à mettre en
strategies
place des
for
systèmes de
responding to the
santé
problems that limit
résilients
countries'
pour faire
ability to
face
set up
aux
resilient health
situations
systems
d'urgence
to deal with
sanitaire.
health emergencies.
En résumé,
In short,
l'UHPR
the
offre
UHPR
une approche
offers a
holistique pour
holistic
renforcer les
approach
capacités de
to
gouvernance
strengthening
des
the
systèmes
governance,
et du financement
systems, and
des États
financing
membres, en
capacities of member
particulier
states,
ceux en situation de
particularly
crise,
those in
afin de
crisis
mieux se
situations,
préparer et
in order
répondre
to
aux
better
urgences
prepare
sanitaires.
for and
Je vous
respond to
remercie.
health emergencies. Thank you.
Merci beaucoup. Would the other
Thank you
two
very much.
panelists like to add anything? Very quickly.
Hi, this is Paula. Thank you so much, Professor Marcel. And also it reminds us that in finance, we normally learn from COVID that in the emergency, every kind of needs, somehow, somewhere countries were able to activate some extra funds or to allocate them when it was most needed. But we also learn when in preparedness, do we need to allocate the proper finance engagement to ensure all the process that allowed healthcare systems to be more resilient, allowed public health services to be able to assess and move with more direct activities in preparedness to prepare to any emergency. And also for us as an EU member state to make sure that we can also use the best of the EU funds in the interest for public health preparedness and response, and within that process to identify the specific areas where those finance funds will be more applicable and provide more enhanced capacities and capabilities. Thank you.
Thank you, Dr. Paula. So if there's no other inputs, I will now move on to Dr. Chawet-son for the final question. In UHPR, the emphasis is on the highest political levels, building solidarity, peer-to-peer learning between member states. Why does emergency preparedness need to be treated at this high level? How does it build solidarity and peer learning from the Thailand experience?
Thank you, Dr. Supriya. May I start my discussion a bit, and then I have 3 slides to share during my discussion. It is about the importance of high-level involvement in UHPR. The COVID-19 pandemic response stands as one of the boldest examples of the phrase health for all and all for health. By the worst impact of the pandemic, as well as the scale and the scope of our response, have underscored why emergency preparedness must be addressed at the highest political level. We needed all people in all sectors to unite and move together through the crisis time. Building on this, the UHPR can succeed through the robust political commitment at the highest level also. Would you share my photos, please? Thailand's experience highlights the essential role of top political leadership in UHPR. Our Deputy Prime Minister committed Thailand to be one of the first 3 countries to pilot the UHPR. And then in April 2022, During the UHPR activity week in Thailand, he emphasized that with close collaboration between the Ministry of Public Health and WHO, the UHPR pilot will be very beneficial to not only to Thailand, but also for other WHO member states on its purpose, methods, and technical content. Okay, hope the slide is coming. Okay, this one, the first page. Okay. And the second page is the Deputy Prime Minister personally announced the UHPR review result alongside the WHO representative to Thailand, ensuring that the media and the public were informed. Next slide, it is the last slide. And you can leave this slide here. This is the last slide. From our UHPR experience, we learned that the most crucial aspect is top political leadership. This was evident during our COVID-19 response, where rapid emergency funding and largest vaccine procurement in our history and significant economic relief measures were possible only through direct intervention by our highest political leaders. Risk communication during the health emergency was managed under the National EOC, or Emergency Operations Center, chaired by the Prime Minister. This ensured daily reliable information throughout the pandemic, preventing misinformation and unverified data from spreading. Solidarity was visibly demonstrated through comprehensive data collection at the EOC, unprecedented nationwide quarantine systems, and collaborative efforts involving the Ministry of Defense, Ministry of Interior, and private sectors. We are thankful to our public health pioneers who initiated universal health coverage, UHC, more than 2 decades ago. At the time, we were a lower middle income country, but we were determined to start it. The result during the pandemic was a flexible system that supported public health emergency operations. We were able to start UHC because of the strong will at the highest political level, expanding our laboratory network for COVID-19 diagnostics and developing some applications with expertise from the Ministry of Higher Education. Leveraging digital technology was only possible due to this unity. The support from village health volunteers further demonstrated the power of solidarity. Looking ahead, a key challenge is ensuring that non-health sectors, civil society, and private business remain committed to emergency preparedness. As we reflect on our experiences, our goal is to improve and be better prepared for any future health crisis, and it will be possible under the involvement of the highest level in the politics. Thank you, Dr. Supriya.
Thank you very much for that and the visual, sharing it visually as well, the experience from Thailand. I now hand over to Dr. Lilian Bulam. Over to you, Lilian, who leads on UHPR at WHO, and she will be moderating the Q&As now. So over to you, Lilian.
Thank you so much, Supriya. Very pleased to attend today. Good afternoon, a good day to all colleagues online. First, I would like to thank all participants who were very actively sharing questions on the chat box. We really appreciate your interest. We have to select some of them, but do not worry, all questions will be addressed later on, or we are trying to do it ongoing. So maybe I will start raising one question that a colleague named Koteba Al-Azam has raised. And maybe I would like to offer that question to Dr. Stella Shongong. Can we say that UHPR is a kind of replacing the duplication of emergency and health system capacity? Do you have some element for that? I give you some time to think a little bit of that.
Okay, that's like an answer that's straight off.
And there's another one from Benjamin Duncan, who mentioned how does the UHPR process relate to the monitoring and evaluation framework of the international health and regulation?
Okay, so let me, I think the two questions are sort of related because the tools that are in the IHR monitoring and evaluation framework are tools that assess the capacities of countries to detect, respond, and prepare for health emergencies. So within those tools, we have the joint external evaluations, which is commonly known as the JEEs, and to date we've got over 120-30 of these done. We've got the states parties annual report, and to date we have 194 out of 196 states parties that have responded to these questionnaires, telling the world what they have in terms of capacities, the status of these. We've got simulation exercises, we've got intra-action reviews, we've got after-action reviews, and our member states in their hundreds have done this to test the functionality of their systems. And that is how, along with other review and assessment methodologies, we collect data on the gaps and priorities and needs of countries. And this will always be there, and it will always continue being there. What the UHPR does is to take these technical tools and recommendations that come out of these and make it to become multi-sectoral, bring in other sectors, but also other parts of the government and the whole of society. We heard from the Central African Republic about the communities coming in. We heard that from Portugal. In Portugal, we had the parliaments, and even in Central African Republic, being part of the discussions. In Thailand, the parliaments were part of these discussions. The communities were part of these discussions. So it's really taking this and saying, how do we make this whole of societal and multi-sectoral? It is taking these discussions now and moving them to the highest levels within the government. We heard about the Deputy Prime Minister in Thailand. We heard about the President in Central African Republic. We talked to the head of the parliamentary committee in Portugal. That is the level to which this process raises this. And in the international arena, it brings it also to other stakeholders, other member states, other partnerships that come together to build that solidarity towards capacity building in countries. And before, we've got over about 100 national action planning processes that have occurred. And yet no plans were fully financed before. And therefore, this process also highlights the key aspects that a country's plan can have and builds that solidarity in supporting this. So these are all the things that bring to the table the UHPR and how it supports the ongoing processes in countries without adding any burden to them or duplicating the processes within the countries.
Thank you so much, Dr. Stella, for this great scope of the response, and country and colleagues participant can understand the interrelation between the field reality and the concept that UHPR is supporting. There's another question that maybe I can offer to both of you, and I'm sure that you will complement. That may be the last one. I'm sorry that I'm frustrating a lot of colleagues here. How can UHPR adapt and innovate in response to emerging pandemic, evolving health threats, and changing socioeconomic contexts in low and middle income countries? So I will maybe repeat it because it's quite complex. How can UHPR adapt and innovate in response to emerging pandemics, evolving health threats, and changing socioeconomic contexts in low and middle income country? Meanwhile, maybe I give you 1 minute to reflect. There's one straightforward question for Dr. Shawat-san that I wish to bring. Dr. Shawat-san, please. That was a very helpful review that you provided. I'm just quoting Scott Dowell. Did the engagement from the highest level help Thailand to save lives during COVID-19? So maybe we can give maybe the first floor to Dr. Shawat-san and then revert to our panelists here in the room. So Dr. Shawat-san, please, the floor is yours.
Thank you very much. Thank you for that interesting question. I believe that the involvement by the highest politicians, leaders, that is the way we try to solve the big problem like the pandemic, because not only the public health sector alone can do effective measures at that time. We need other ministry, other sectors to work with us, and also many budgets, a big budget from other sectors move to support the public health response. So this one, I can say that the involvement by the highest level save lives, because in many technical advice cannot be true if we didn't get the support from the highest level. So to me, I think to make it very effective, it's based on the system. Some part we need to take time, take long time. In my discussion, we are thankful to the UHC in Thailand that it's like about 2 decades at the time of the pandemic. So it paved us the way how the engagement of the civil society, the technical expert, and also the politics to move to work together and we have had a good platform. Budget line about the health is secure, and then once the public health emergency happened, we can rearrange for the emergency response. So in short, I can say that involvement of the highest level is really important and save lives. Thank you.
Thank you very much, Dr. Shawat-san, for this comprehensive feedback. So maybe I turn back towards our Assistant Director General. I don't know if you can take some of the questions that were raised to highlight colleagues. Thanks.
Thank you very much, Lillian, and thank you all for a very engaging dialogue. And it's really a refresher again to hear from country colleagues underscoring again the value of UHPR. 5 points I would like to quickly make. Hopefully we'll address some of the questions and new thoughts that came to our mind here. I think UHPR is truly carving a new path for multilateralism in health, and health that connects with sustainable development goals. The second is it's also creating new habits of cooperation, new habits for how we can trust each other in terms of our technical, operational, and political capabilities and the spillovers it will have across the borders. The third is it's truly improving the capabilities and capacities of accountability and monitoring our health information systems, health workforce, health systems itself, and recharging the way we use UHC and primary health care and improve the environmental policies such as water, hygiene, and sanitation, which came really on top of the list during the COVID-19 pandemic. And finally, I think it can truly be a catalyst for change. We always say we want an equitable world. We want to leave no one behind. And I think this could truly help us bridge, but bridge with speed and resources. And we have seen how countries have used this mechanism to improve legislation to access and attract financing. So ultimately, I think we stand at a crossroad. Next week is going to be defining with the pandemic agreement, international health regulations, and a review of how we will double the pace of progress to meet the SDGs. We have already fallen behind. Within just 2 years of the pandemic, we have lost healthy life expectancy by 2 years, in 2 years' time. So we really have a lot to catch up on. It is in a way catch all. And I don't think it's just in words, but what we have seen is that this idea has truly shown that it can be applied on the ground at subnational and national levels. And as Paula said, national engagement in an international process, and how Thailand mentioned the scale and scope and embedding this on 20 years of universal health coverage. And it can still be undertaken amidst a crisis that we saw in the Central African Republic. So I think huge potentials, but we really want all of you to be engaged with us in advocating this. We want as many countries to join and appreciate, although it is a voluntary process. And I think that is how it is going to be successful, because it's not mandatory. And again, a new form of multilateralism. So look forward to more questions and more engagement. Back to you, Lilian.
Thank you so much, Dr. Samira. So I'm watching time, and I'm afraid that we have to give back the floor to our main moderator and hosting colleague from EPI-WIN. But before, just maybe to take some of the points that were raised in the question related to which country are currently enrolled within UHPR, having more information on indicators, impact, CSO, criteria or prerequisite. I will invite colleagues to go on the website, because within the frequent asked question, all those points are deeply developed there as well. You have record of different meetings that we have organized with different type of stakeholders. So please take some time, enjoy, take a glass of coffee, cold coffee, most likely, because you will need some, and enjoy that reading. I would like also to make a last point. UHPR is for all countries. I can see some question related to the social economical development of the country. We have low and middle income country, and we have as well high level middle country. So all are inclusive in the UHPR. There's no criteria to engage in that process. It's tailored to each country regardless the situation is facing. With that, and with the permission of my colleague in the room, I would like to give back the floor to our host, Dr. Supriya. So please, Dr. Supriya, the floor is yours. And sorry for taking a few extra minutes.
Thank you very much, Dr. Lilian. And I'm so glad for the interesting questions and the great points that were made as well. I'd like to wrap up now and thank everyone, particularly, first of all, our panelists from member states. Thank you for taking the time and trouble to share your experiences. I hope this has inspired other member states who will then take this process up voluntarily. I'd like to thank Dr. Samira Asma and Dr. Stella Chengong for being with us also today and taking the time. But most of all, I'd like to thank the team behind this. They have not been visible, but they've done most of the work. That's Dr. Lilian and Dr. Niluka, who's in the room with Dr. Stella and Dr. Samira, and Ernest, and the others in the UHPR team. Thank you very much for making this possible. I'd also like to thank my colleague Sadrish Pradhan, who's been in the background sharing the slides and helping me with the tech as today was not a great tech day, but she's been wonderful. So thank you. Thank you to the interpreters and to Odeka for helping us also with getting the interpretation in. But last but not least, thank you to all the participants for being so involved and engaged as usual. We will share the video, we will share the recording with you. We will also share all the information from UHPR, the website links and everything else. We will try and answer as many of your questions as possible. You might find that some of that you will find in the website, but we will work with the UHPR team and see if we can answer as many as possible. And please continue to join us in further EPI-WIN webinars. We have a few lined up for June, and we will let you know the dates very soon. And I hope to see you soon. Thank you very much once again. And have a great week. Bye.
Thank
Thank you.
you.
Bye-bye.